my name is Stephanie. I graduated from Carroll in '98. I currently work for the Kettering Health Network at the Beaver Creek Health Center. I am an X-ray tech, a CT tech, and I started out in phlebotomy. I actually started out as a medical office specialist. That was my first degree that I got from Sinclair, and I worked front desk there. From there, while I was on the waiting list for the radiology program at Sinclair, I got my phlebotomy certificate. So I can work front desk, I can draw blood, now I can x-ray, and I also do CT. I've been there for about 7 years. I can't really say that any of them are my favorite because I like doing all of them. I like being able to float around and not do the same thing every day. By doing all of the things that I do, that gives me that opportunity. I don't, it's not redundant for me. I don't get tired of what I do. I am currently at Ohio State. I'm getting my bachelor's in radiology administrations. I graduate in May with that degree. Let's see. I didn't go do this program like right from Carroll. I did a lot of dead-end jobs for a while and then decided I needed to do something different and something that would benefit my family better. So I did everything in reverse. So I had my family first, then I went in about 2012 I got my degree as a medical office specialist. In 2022 I got my degree in radiology, and then obviously I'm at Ohio State now. The thing I like about radiology and why I think it is a great field is that you do not have to get a bachelor's degree for it to actually be very successful in it. It is a 2-year program at Sinclair. There is a waiting list. Kettering College typically does not have a waiting list. They can get you in pretty quick. Both programs are very good and incorporate students in all of the hospitals in our area. It is one of very few programs that you do not have to go 4 years and you can be very successful at. I also like radiology because there are a lot of different careers you can go for. You can just do x-ray, you can do outpatient, you can do inpatient, which are very different. I do outpatient. You can do surgery, where you work a C-arm in surgery. You can do traumas, like at Miami Valley. You can do cath lab, which is working a C-arm while they're doing catheterizations in patients' hearts. You can do CT, which I do. You can do MRI. You can do interventional radiology. Interventional radiology, that is where they do a lot of like bulbar nerve endings, and they have to see what they're doing. So you have a C-arm, which is a surgical x-ray unit. And so you're going to position the C-arm so that they can see what they're doing. And then, like I said, cath lab is another good pathway for that. Ultrasound is also a really good way to be in our department, but ultrasound is its own degree. You cannot get ultrasound by going through radiology. And Sinclair does not offer ultrasound, only Kettering College does. But ultrasound is also a very, very good career.
Is that also 2-year or 4-year?
I believe Kettering College does a bachelor's program. Okay. That's a good question for my ultrasound tech friends. I could find that out. I think they may offer 2-year, but they do. Kettering College does like a pathway where you can get your bachelor's while you're doing more than one thing. So Sinclair doesn't offer that, but I think you can do those kinds of things at like UC or Wright State, maybe Ohio State. You can get your bachelor's while you're getting your associates, but you do not need a bachelor's. Like I said, just a 2-year program. The one thing that you do have to keep in mind with radiology, though, is it is very, very difficult to work. I did work while I went through the program, but it is difficult to work. You pretty much are it's like the school day. Like you are Monday through Friday between classes and clinicals. So you were in the hospital for the first year, you're in the hospital 2 days a week, and in classes 3 days a week. For the second year of the program, you're in clinicals 3 days a week, and in classes 2 days a week. But you do go through with the same people, and you kind of build relationships, and the radiology community is a very close-knit community. Everybody from all the hospitals pretty much know each other. We're really close-knit. I really like that about our program too. Do you guys have any questions? Yeah.
How many total years of schooling do you have?
Do I have?
Yeah.
I have my medical office specialist, which was 2 years at Sinclair. My radiology was 2 years. And then I've had 2 years at Ohio State for my bachelor's. I also took classes while I was on the waiting list for radiology. So I am 1 credit away from also having my associates as a healthcare, it's just a general healthcare degree. But I probably will not get that just because it's an English course. I find like anatomy and physiology to be really interesting. I like medical terminology. So while I was waiting pathophysiology, I took a lot of those courses just because I thought it would be easier for me once I got into the program. So, and it did help a lot. So, I do want to say about phlebotomy. Phlebotomy is just a certificate. It is a great way of getting into healthcare. It's entry level. It does pay pretty good for being entry level. It's also a lot of fun. It's challenging, but it's really rewarding, especially when you get somebody in there and they're like, I'm a hard stick, nobody can ever get me, and then you get them and you're like, yes. So it can be a lot of fun too, and a lot of times it's a great way of getting your foot in the door at a hospital. So, and you do not have to, like, it's a certificate, so like that's something that you guys can do straight from Carroll, is get that certificate. You can get it at CTC, you can get it at Sinclair, and you could be working as a phlebotomist while you're getting your radiology degree. CT and MRI, you have to have radiology first. So I got my certificate for CT after I did my x-ray. You have to do it that way. And then you do so many exams. I was able to do it at work. I had to do so many CT exams and then take the registry exam. And then now I'm CT registered. Any other questions? What are you guys interested in?
I want to do CTs and MRIs and stuff like that.
Okay.
But I'm interested because I'm not really sure what phlebotomy is.
Phlebotomy is drawing blood.
Okay. Yeah, that's not sure.
Yeah. Phlebotomy is drawing blood, which is a good skill for a CT technologist to have, because we do IVs. So especially if you work outpatient, we inject contrast, and so you have to start IVs. So if you already know how to draw blood, how to stick patients, then you already are ahead of the game there. When you work in a hospital, though, you do have to know how to do it, but a lot of times the nurses have already done it before the patient comes to you, so you don't have to do it as much. Typically, when you do your clinicals, a lot of times that is like an interview process for you. It's like an informal kind of interview process. Most students are hired by someone they did clinicals for. Especially in my year, a lot of our students were given sign-on bonuses and were hired straight from clinicals. I actually did my clinical rotation at the VA, Dayton VA, and I was hired there as PRN. I ended up going back to Beaver Creek. I never left Beaver Creek, but I ended up going back to Beaver Creek because they were able to give me the hours I needed. And with the instability right now, there was just, I wasn't able to get the hours at the VA. But I have my foot in the door at the VA. So later, if I want to go back and retire at the VA, I have that option. So, like I said, radiology is a very close-knit community, so it's really easy to meet hiring managers everywhere and to get your foot in the door. Yeah. I do have some pictures of CTs, some pictures of x-rays. I have our Bontrager, which is like our Bible for positioning. It teaches us how to position. I have some needles, some supplies for blood draws, anything anybody would like to look at, I'm more than happy to show you.
Out of all of your jobs, which one's your favorite?
I get bored really fast, so they're all my favorite. I get if I'm doing the same thing over and over. Like I was in the lab for 3 weeks because our lab tech was out, and so I'm ready to move on from lab right now. I really enjoy lab, phlebotomy. I really like X-ray. I really enjoy X-ray too. Yeah, so probably X-ray. I like CT. I tend to favor what I feel the best at, you know, like the most confident at, and CT is the newest for me. So right now I enjoy it, but I feel more comfortable in X-ray or lab. But
Hardest class at school?
for
you.
for radiology,
Yes, let's go through each of them for radiology.
sciences, radiologic sciences. It is a lot of physics, but it is geared towards X-ray. So the program used to have physics, like you had to take physics just to get in, and they don't do that anymore. Now it is specific towards what you're doing. So basically, the kinds of things that you'll have to think about is the mass and kVp, which is the amount of radiation dose that we're using for patients. There are equations to figure out the right dose of radiation to use to get the most optimal images possible. So that's really what's in radiologic sciences, plus the amount of dose that is safe, radiation safety, and things like that. So they're challenging classes, but you know, they give you the tools to pass it. Sinclair is very much pass the test oriented, so they really work with you very hard on being able to answer those science questions to be able to pass the registry exam. Kettering is very good about their patient care, about their clinical rotations. Their students go in ready to know how to do the exams. So they both have their good and their, you know, their good points. So because we worked a lot with the Kettering students also, and they also did really good.
What are some challenges you've had, like in the everyday job, that you've had to overcome, and how did you overcome that?
I worked in healthcare during COVID, and that was the hardest part for me. Was the general public that was angry with us because they had to wear masks when it wasn't our choice, it wasn't our decision, it wasn't anything we could do about it. And that was felt everywhere, though, I think, not just in healthcare. But, you know, we were physically working with COVID patients, so it was very important for us to keep ourselves safe, to keep our patients safe. And so it was a very challenging time to work in healthcare, and then to have people angry with you on top of it. It was hard. And I went through my clinical rotation during COVID. So my first year of X-ray school, we had to take our classes on Zoom. So that was pretty rough to learn that difficult of material through Zoom. I mean, it had its benefits too, because then the Zoom recordings were recorded and we could go back and watch them before our test. So I found some benefit in it too. But we also, our first year, were not allowed to go on portables, and we were not allowed to go into surgery. So I feel like I ended up a little bit behind on those things. But I ended up working in an outpatient site, so I don't have to do those things. So I figure if I ever have to go back to the hospital, they're just going to have to retrain me. So those are really our biggest challenges. On a day-to-day basis, not including COVID, phlebotomy is a job that everybody tells you what to do. Every patient thinks they know everything, and you just kind of have to go with it. You have to have good patient skills. You have to have good customer service skills. You want to make them as comfortable as you can, because the more comfortable they are, the easier your job's going to be, the easier it's going to be on them. So that's probably the most challenging thing that I come across. People who are in pain. It's hard to see people in pain. It's hard for me to put people in pain, because sometimes you try to stick a patient and not cause pain, but it is a needle. It's going to happen sometimes. So I just try to minimize their pain as much as possible and try to be a positive, influence on them and give them a positive experience in spite of what I have to do. Any other questions?
Yes, what's
Sure.
it called, the
The phlebotomist?
the phlebotomist? Can you just, is there like programs in the summer?
Mm-hmm.
And then there's like, can you do it like before you enter college?
Yeah.
Okay.
So the CTCs usually have like 12-week programs. So Sinclair's is 2 semesters. It's, I don't know if you have to take them in a specific order or not. It's been a long time since I did that one. But one is the course where you actually go into the classroom and they teach you how to stick a patient with a needle, and you practice on each other. So that's fun. But then the second semester is a clinical rotation, it's 100 sticks, so it's not a whole lot of time. But once you get those 100 sticks, then you get a certificate, and you're able to get a job in phlebotomy, which is in high demand. There's always demand for lab techs and phlebotomists. You also, with phlebotomy, you don't always just stick, or being a lab tech, you don't always have to work with patients. We need processors that sit in the lab. After a tube is filled up, each tube has like a different additive in it to make the blood do what they need it to do. And then we have to put it in the centrifuge and spin it down to separate the red blood cells from the plasma, or the red blood cells from the serum, so that they can get what they need to run the actual tests that they're doing. So we always have processors that in the hospitals that have to do those jobs too, where they're actually testing the blood or putting the blood in the machines that run the tests and things like that. Those are all really good jobs too.
And you have to have a phlebotomy certificate for those.
Phlebotomy, and they also have lab assistant. I would say if you really wanted to do processing over sticking patients, I would do the CLA, the clinical lab assistant program instead. But that is also a certificate. Either one my job is a CLA. My certificate is in phlebotomy. I do both. So I think either pathway, either certificate's going to get you that job.
Like, to be a pediatric radiology tech, is it different than like the regular? So it's just the same stuff?
It's, and children's is always needing techs. So I think Sinclair is now doing a clinical rotation where every student has to work at children's for a little while, do a rotation at children's for a little while. Working with children is the same as working with adults, except for, you're using a lower dose of radiation. The actual taking the images is exactly the same. The challenge with children is to keep them positioned. So you'd have to have really good skills working with children. I would love to do that job. My husband works for children's. He doesn't work with children, but he works at children's. But I don't think I'd have the patience for it. I like working with the elderly. I find it very, very rewarding. But there's so many different ways, so many different jobs, so many different careers that you can do in radiology. It's incredible. Just that 2-year degree gets you like an open door to so many different things, and some of them are very financially rewarding. Working in the hospitals, working second, third shift, if you're willing to work those hours, if you're willing to be on call, you can make a lot of money in cath labs and things like that. And interventional radiology, MRI is really, really high paying also. MRI is a lot of physics, a lot of science in MRI.
Are you saying no to the science or
No,
no?
I'm not saying no to the science, but like the physics part.
Well, like I said, the physics that you learn as it relates to radiology. So it does make it easier. It's not like you're just taking a physics course. You are, wrapping your brain around how it works regarding radiology. So that helps, because I'm not a science-y person either, and a friend of mine that I graduated here with in '98, she is an MRI tech. I've actually worked with her for a while, and she is incredible. And if you met her on the street, you wouldn't think that she's that sciencey either, but she's a really, really good tech. And she did it straight from Carroll, so she's been a tech for a really long time. Yeah.
So is there other ways like to get into the program? Because like not going into specifically radiology, like could you still do something like that? Because like, I don't know.
Because the course, the program sounds
Yeah.
good.
Or is it just strictly that major that you have to do?
So there is something called a GXMO. They've really kind of done away with them. There are some still out there. Typically, you just really study for the GXMO exam, and then you take it and you get a GXMO license. Usually, GXMO techs work in like urgent cares and things like that, where they're MAs also. So they're an MA that will do X-ray. That is pretty much the only other way that you can do X-ray, because, I mean, if you think about it, we're working with radiation every day, so the state takes it very seriously, that we have to make sure that we are not over-radiating people and causing harm to patients. So it is a difficult program to go to, but it's very rewarding. It's worth it. For me, I have 4 kids, and I did it with 4 kids and running bingo here. I did it all at the same time, and I was able to do it. So I had a lot of support, but as long as you have that support, it's doable. Plus, you lean on your other students for support to you. When you go through the program together, you have people to study with. You have people that are going through the exact same thing that you're going through, and you work together. And we had study sessions where our entire class got on Discord right before our exam, and we were all like cramming together, and it made it so much easier to get through it that way. So it was, I'm really, really glad that I went through the program the way that I did. I think I benefited a lot from it.
What are your hours like? Like, how many hours a week do you work?
I typically work 4/10s. Lately I've been working 4/10s plus another 4-hour shift. That's my choice though, because I work for an outpatient site. I could work, 5/8s if I wanted to. I could, so my site isn't open in the nights and weekends or holidays.
So you're not on call or anything like that?
Correct. So I worked there before I got my radiology. Typically, a student just graduating from X-ray school is not going to get the good hours like that. The only reason I did is because I made myself valuable to an outpatient site by knowing front desk, by knowing phlebotomy. So I had already known that and worked there before I got my X-ray. So they wanted to keep me because I was valuable, because I can fill in if somebody calls off. I can just slide into their position and us not have to close a modality. And I totally did that on purpose because I did not want to work the hours.
Yeah.
So a lot of times students will start out second or third shift, weekends. There's so many different formulations of the schedules. There's 3 12s on the weekends to work full time. You can work all third shift. The only thing I can say about working second or third shift is do it while you're young, because you can really put some money in the bank, because their shift diff is crazy. It's crazy good. And if I didn't have a family, I would be working second or third shift at the hospital, being on call. I would take all of that money, because they're just throwing money at you to do those hours and those shifts. Especially if you go into like cath lab or interventional when they need people on call. Sometimes, they need like interventional or cath lab, like that's life or death. So they need to do those heart caths like right away, and they're going to call you in. Well, you get your on-call pay, plus you get the pay for being called in, plus you get your shift diff. So it's crazy money to do something like that. So it's rewarding if you get the bad shifts. They make sure that you're rewarded for it.
And all that with a 2-year degree instead of a 4-year.
Yeah.
So keep that in mind.
Yeah, yep. There is a waiting, like I said at the beginning, there is a waiting list at Sinclair. You have to do your prereqs, and you have to do like your intro to radiology course, make sure you're still interested in it, and you have to take the TEAS exam. And sometimes your score on the TEAS exam can get you pulled up faster on the waiting list. So if you do good on the TEAS exam, you can get in faster. But Kettering doesn't have a waiting, so they'll get you in right away. So I waited, and like I said, I did other courses while I was waiting, stuff that I thought might help me in the program. And then I am 1 credit shy from another degree if I really want it. I can always take that class and get it if I want.
Class.
Yeah. I just, especially after getting my bachelor's, I don't know about writing more papers. That's not my thing. That's why I work in healthcare.
Yeah.
So this is our power injector. This is what we inject our contrast with. I actually have the syringes in that box there. I can open it up if you guys wanted to look at it, but these are the syringes and the tubing and everything.
Is that for contrast during CTs?
Mm-hmm.
Have any of you guys had those?
Microsoft.
Mm-hmm. Oh, you'll see all kinds of brands that you.
Yeah, that's kind of
I think our scanners at GE, Samsung, GE. This is a scout image of a CT scan. Let me turn it this way. So we take a scout image so that we can line everything up. So this is obviously a person that has an artificial knee, and they have rods. This is some really crappy looking lungs. These are all CT images here. So this is the entire abdomen. So CT is 3-dimensional, so you can look at a patient like through their body, you can look up and down, you look side to side. Here we're looking, going down through the patient. It's really cool. Do you guys want to know how CT is done? So we basically have an X-ray tube and a detector, okay, and inside the scanner. It's inside this donut, okay, and it spins, and it's taking hundreds of pictures at a time, okay, and then the computer will take all of those pictures, and it'll put them together into those 3D renderings, and so you can turn it to anterior to posterior. You can do superior to inferior. And you can do sagittal, which is side to side. Here's another scout of a foot with a lot of stuff in it. There's a head.
Okay, that didn't look really good.
No. But when you go through the program, they'll teach you how to like find pathology in these pictures and tell what you're looking at. Let's see. This is the aorta here. They're probably measuring an aortic aneurysm there. And then when we inject contrast, so it goes through, the venous system, and then it goes up to your heart, and your heart sends it back out to the rest of your body. And so then that contrast will start highlighting anything that the blood supply is going through. So you can, in the abdomen, you can see it'll highlight the kidneys. Here's the kidney. That's not a very good looking kidney either. We also have oral contrast where they drink it so we can see the bowels better. Highlights the liver a little bit. And then this is contrast going through the heart right here. So it like makes it brighter and you can see things a little better. So I think that's all of them. Yeah. That is really not a good looking kidney there. My lead tech gave me these pictures, and I haven't actually sat and looked at them. She just thought it would be cool if I brought them in. Yeah. This is my son's pictures. He had surgery last year. So they cut his tibia and his fibula and put plates in. His toes turned outwards, so like his feet were turned like this, so they cut it so that his feet turned the right way. So, these were probably done right in the OR. So there's the one picture.
So that's one of the options they have, is being somebody who does those types of things.
Surgical. Mm-hmm. Yep. I used to know somebody that worked surgery at Children's, was a surgical tech at Children's. Oh, I had one. There it is. This is X-ray. This is an X-ray of a pediatric abdomen. He's very backed up. Very. This is gas bubbles here.
Ooh.
This is all stool. That's really common with little kids. And this is up here. This is his lungs up here. Diaphragm. And that big air bubble there. That's what happens when they get backed up, is the air gets trapped there. So then that's one way you can tell they're backed up. So kids are really fascinating too, because you can see the growth plates. You can see where the bones aren't fused. You can see it on his little femurs here. But there's like a little gap. It almost looks like a fracture, but it's actually the growth plate. Don't you know who that is? Anything else? You guys want to look at the needles or the tourniquets? Or there's some really cool pictures in here too of how to position patients.
You guys can go.
Oh, sorry, is that like every student gets?
Yeah, and all of us techs carry ours around because every now and then, which is part of the fun of the job, you'll get a view that you haven't seen in years. And so we get our bontrackers out and we look them up. Because there sometimes will be a doctor that wants to see something very specific that we don't do every day. So, which always makes it fun.
Is there stuff that you do every day that you go almost every single day seeing?
Chest x-rays. Chest x-rays, chest CTs, head CTs. For CT, it's head is the most common, head without contrast. For x-ray, it's chest. But we also get a lot of feet x-rays. We work closely with a podiatrist, a foot doctor, so we do a lot of standing feet. So, and we get a lot of shoulders, hands. Being outpatient, I see a lot of the ortho stuff, which I like, a lot of the ortho stuff. You can work for an ortho clinic. We did a clinical rotation with that ortho clinic right across from the bowling alley on Woodman. And so all they do all day is ortho is orthopedic surgeons. They do like spine surgeries or foot, like the bones. So a lot of those x-rays are just spine and hands, feet, shoulders, hips, a lot of that stuff. A lot of the joints are easy to x-ray. Phlebotomy is also one that you can actually be trained on the job. A lot of times if you get a job, which is also entry level at one of the hospitals as a transporter, a lot of times they'll teach you how to do phlebotomy also. And then you don't have to have your certificate in it. I personally don't like transporting, but some people find it enjoyable, where you're just pushing the patients on the stretcher throughout the hospital. Another thing that I do, our lab techs do outpatient is EKGs. I didn't even think about that, but we perform EKGs on patients also, where we just attach stickers all over their chest and then attach leads and then monitor the electrical activity of their heart, which is also really interesting.
Is that part of your training for CT or for...
No, we do. It's the lab tech that does it.
Okay.
And for EKG, I was just trained on the job. In the hospitals, they have actual departments that do EKG. It's not usually the lab tech, but outpatient, they they just have the lab techs do it.
So if you're trained on the job, do you get a certificate then from the hospital, or do you just not need a certificate?
No.
It's just something that you have experience in?
Mhm,
Okay.
mhm. Yep, but once you have experience in it, then
Then it
you can use
counts.
that experience. Mhm. Yep. Yes.
But on the job training, does that transfer to other places, or would you have to go get a certificate? Like, if you're going from Cincinnati Children's to Christ Hospital, would you be able to?
I would just put on my resume that I perform EKGs.
Gotcha.
So they would consider that experience in it.
Gotcha.
Interesting.
How long did it take you to get a job after the phlebotomist degree or certificate?
I had the job already. I worked as a medical office specialist. I did have a really hard time finding a job after I got that degree. I worked for a long time for a home health agency, and it was because I knew somebody that worked there that I was able to finally get the job at Kettering. A lot of times it's who you know, which is why the X-ray program is so valuable because, or getting your certificate in phlebotomy is so valuable because when you do that clinical rotation, 9 times out of 10 they hire you right there. So that is your foot in the door. The medical office specialist, I mean, I just worked in an office and it's also entry level, but there's not as high of a demand for it. So it was harder for me to get a job through that. I was very, very fortunate to know somebody that got me the job where I'm working now and to get my foot in the door there. And like I said, from there, I did the phlebotomy, then I did the x-ray, then I did the CT, and I made myself valuable so that I didn't have to go work at the hospital. Not that there's anything wrong with working in the hospital. If that is something that interests you, if trauma interests you, the hospital is where you want to be. I do find it fascinating. The only reason I don't do it is because I have a family. I would definitely, if I was single and before I had kids, if I had done this before I had kids, I would definitely have worked in trauma to get all of that experience, and it's just really, really interesting things that you get to see.
Important job for sure.
Very, very important. Very important. We're lucky that we get most of the time we get the patients that can walk, like they just have chronic pain, so they need to x-ray their shoulder or something like that. Every now and then we do get breaks and something major going on, like appendicitis or something like that. I mean, we do have critical finds also, but just not as often as the hospitals do.
Do you have a general idea of how much phlebotomists make versus how much x-ray techs make and CT techs?
Phlebotomy is going to be more entry level. I know more what we top out at than what we start with. No, we probably start between $15 and $20 an hour, or ending at about $20 an hour. So I mean, that's not hateful. X-ray is going to be between starting out the high 20s to 30, but the scale goes much higher than that. CT tops out at $40 an hour. MRI goes higher than that. Interventional, cath lab, nuke med, I haven't even mentioned nuke med, or radiation oncology, which is using radiation to treat cancer. That's also radiologic technologists, that's our field. They make way more than that.
What would be like the process for doing the oncology?
Oncology?
Yeah.
So you can actually go to one of the universities to get a degree specific in radiation therapy. I think you do need to start out with radiology. I'm not quite sure with oncology if you have to get the bachelor's or not for that one, but you would start out as X-ray, and then you could go from there. Nuke med, I think you can go straight into these things. Like you can go to a university and go straight to radiation therapy and nuke med, and then go straight into working those jobs. But you could also just get your x-ray first and then go back to get those. Nuke Med they make really good money. I know a Nuke Med tech that was making $50 an hour. I know an MRI tech that was making $50 an hour. So radiology, like I said, radiology is a field that you can just keep going in and starting out with just a 2-year degree. You don't have to do it right away. You can just get your radiology degree and then, do x-ray for a few years and then go on to do nuke med or oncology. That's a very rewarding career, I think. It's helping cancer patients. There's also phlebotomists that work at Cancer Center. Those are the best of the best phlebotomists, are the ones that stick cancer patients because chemo kills veins. I am very thankful that I went through this program. I love my job. I can't imagine myself doing anything else. My only regret is that I didn't do it sooner. But I'm still able to do it and still very thankful that I did it. I don't know an x-ray tech that has any regrets. I've never met somebody that has gone into the field and then left it. Yeah.
Why did you first start doing this?
Why did I first start doing it? So after I got my medical office degree, I was still having trouble making ends meet. And so I like working in healthcare. I liked working in healthcare then. I liked working with patients. But I needed to find something that would sustain my family better than that degree did. And so I looked into it more and decided that this was the field that I wanted to go into. It was something that I was always interested in. To be completely honest, I wanted to do ultrasound. But Sinclair not having an ultrasound program, I decided to go with radiology. I have no regrets there. I'm happy with the way I went. I do sit in on ultrasounds. We have a male tech that does pelvic exams and we have to chaperone for him. And it is very fascinating, but I couldn't read those. It just looks like a black screen to me. I've seen a lot of things, and I've only done this I've worked for Kettering for 7 years, and I've seen a lot of really interesting things and met a lot of interesting people. We have repeat patients that you get to know, and they get to know you, and it's very rewarding.